I've been qualified 15 years and have specialised very early in rehabilitation of any injuries, orthopaedic, muscular, and have been a physio manager at a hospital, gained a lot of experience, worked closely with consultants and GPs, and now run my own practice. I have had a lot of hand experience in my training in that I worked in South Africa on mining hospitals, and most of the injuries are crush injuries of the hand. If you look at the product, you can see yourself that it's just a ring with holes in. There's nothing complicated about it. You could use it for things like carpal tunnel, arthritis in the hand, tenosynovitis of the wrist or the thumb, fractures or surgery to the hand and wrist, tennis elbow, golfer's elbow, to name a few. Most sports people are either holding a racket or gripping or holding a ball, and so therefore hand strength is really important to all those functions. Therefore, this hand trainer is a great addition to their training. All rehabilitation starts from being really weak and then building the strengthening up gradually as the patient progresses. So having different resistances allows you to take them from the beginning of their rehab to final rehabilitation. It comes with a pink and a yellow band, and both of these are a lot easier to pull apart. And the blue and green bands are more appropriate for the sporting population or final rehabilitation because it requires stronger resistance to open the band. Thumb extension is movement of the thumb away from the palm. So how we apply that, we put the band around the fingers, put the thumb through one of the holes, and then open the thumb away from the palm. This is particularly useful with tenosynovitis of the thumb, arthritis of the thumb, and just generally in most hand injuries. Thumb abduction is movement of the thumb away from the index finger. So how we apply the band to it is we put our hand through the middle of the band, then put the thumb through one of the holes, and then we move the thumb away from the midline like that. Wrist extension is the ability of the wrist to bend backwards, and how we apply that to the band is we slide one hand through the band, the other hand underneath, and then we will bend the wrist backwards against the band. This is particularly useful for injuries like tennis elbow. Finger extension is the ability of the fingers to bend backwards at that joint. So there are two different ways we can do this. We put each individual finger through the band and then extend the fingers. And that is working the thumb as well. If we want to take the thumb out of it for whatever reason, if it's injured, or make the exercise a little bit harder, what we can do is slip our other hand through, holding the band, and then extend the fingers like that. Once we've strengthened the individual muscles, we can combine the products and strengthen the hand more functionally. So we put the ball in and have the band around the fingers. We squeeze the ball, straighten out the fingers. That is generally good for functional hand strength, so incorporating all those individual muscles that we strengthened before. Having them together means you can work both flexion and extension of the hand and all the other associated movements that you require, which is what gives us the dexterity. So having the two together is fantastic because you can send someone away working both elements, not just one or two elements. The main thing with exercise is you need to do it constantly through the day. And the nice thing with a hand trainer, it's quite easy to take it with you. Considering all the things it can achieve, it would really make sense to most people who have a hand injury to purchase one because they will really see the benefits after using the product for a few weeks.